Have you ever stopped to think that that simple tingling in your arm, that numbness that suddenly appears out of nowhere, could actually be far more serious than you imagine? Yes, a huge number of people, truly countless, believe that this discomfort is nothing more than bad posture, a pinched nerve, or maybe just accumulated stress. But let me tell you something, and listen carefully, because this might even scare you. In many cases, this numbness is a desperate cry for help from your heart or your brain. That weird discomfort that starts out of nowhere, usually in the left arm, sometimes travels up to the shoulder, down to the fingers, or stays as a strange feeling of heaviness, tingling, or numbness. Some people even feel it only in their pinky finger. Can you believe that? And yet, most people ignore it. But this is, in fact, one of the classic warning signs of a heart attack. And it's not just me saying this. Scientific data and serious medical studies confirm that during a heart attack, the pain or numbness can radiate to the arm, shoulder, and even hands. And you know what's even more terrifying? Sometimes a heart attack doesn't come with chest pain. That's right. There's no dramatic movie scene of someone clutching their chest in agony. Sometimes it appears only as a strange numbness, an unusual sensation in the arm or hand, especially on the left side. And what's the biggest problem with this? So many people waste precious time thinking it's nothing serious, that it'll pass. Meanwhile, the heart is struggling, begging for help. And it doesn't stop there, because when we talk about numbness, we can't forget about another dangerous enemy, the stroke. And this one is even more cruel. The tingling doesn't stay just in the hand. Suddenly your arm feels heavy, numb, weak, combined with a crooked face, trouble speaking, trouble seeing, sometimes even an extreme headache like nothing you've ever experienced. And listen carefully. If this happens to you, don't think twice. Go to the hospital immediately. Because in this situation, every single second is worth gold. Every minute wasted is a piece of your brain that may never recover. And let me ask you, from the bottom of my heart, did you know this? How many times have you felt numbness and simply ignored it? How many times have you thought, it's just my posture, or it must be stress, and brushed it off? Did you know that according to the Ministry of Health, stroke is the second leading cause of death in the United States, and heart attack is the first? And that, very often, both of them start in the most innocent way, with a simple tingling sensation? And do you know what's the saddest part? It's seeing patients arrive at the hospital far too late. I've treated people who spent hours, even days, feeling that weird numbness in their arm, that strange discomfort, and only came in when half of their body was already paralyzed, or when their heart was already seriously damaged. And you know what they always tell me? If I had known it was this serious, I would have come sooner. And every time I hear that, it breaks my heart. Because I know that if they had come at the first sign, the outcome could have been completely different. Their life, their family, their future, all of it could have been saved. And listen, I'm not here to scare you. I'm here to open your eyes. Your body speaks, it screams, but we so often choose not to listen. That numbness in your arm, shoulder, or hand, especially on the left side, it is not normal. It's not your imagination. It's not stress. It is a serious warning that something very wrong may be happening inside your body. And maybe now you're asking yourself, but doctor, how do I know if it's serious or not? The answer is simple. Pay attention to the other symptoms that come with it. If, in addition to the numbness, you feel chest pain, that sensation of pressure, of heaviness, like an elephant is sitting on your chest, And if it comes along with shortness of breath, cold sweat, nausea, dizziness, fainting, or overwhelming anxiety, don't wait. Call emergency services. Get to the hospital, because it could be a heart attack. And heart attacks don't wait. Heart attacks kill. Now, if along with that numbness you notice that you're having trouble speaking, that your mouth is drooping to one side, Are you still thinking that this is just fatigue, just stress, or maybe a pinched nerve? Let me tell you, with all the experience I've gathered from years of treating patients, those who listen to their bodies save their own lives. So if you or someone in your family is feeling this kind of numbness, especially if it comes along with those other signs I mentioned earlier, do not underestimate it. Don't wait. Take action. Because when we catch it in time, we can save. We can save the heart, we can save the brain, we can save a life. If there's one silent villain that destroys the body from the inside without making any noise, that villain is diabetes. And do you know what the problem is? Many people think diabetes is just high sugar, just glucose out of control. They think the worst that could happen is having to take a pill, skip a dessert here and there, and life goes on. But it's not that simple. Diabetes is sneaky. It works silently. And when you finally realize it, it's already caused massive damage. One of the most common ways diabetes shows up, and sadly most people ignore, is that tingling in the hands, that numbness in the fingers, that weird feeling that comes and goes and then returns even stronger. Do you know what that means? It means diabetes has already started attacking your nerves. This is called diabetic neuropathy, one of the most devastating complications of this disease. And listen, it doesn't care about age, doesn't care about social class, doesn't care about anyone. It starts slowly, almost always in the feet. It begins with tingling in the toes, that burning sensation, those tiny electric shocks that seem to come out of nowhere. And over time, it creeps upward, into the calves, into the thighs, until suddenly it's in the hands, in the arms, and then it forms what we call the glove and boot pattern. That's when numbness completely takes over the extremities. And there's something that really worries me. Nearly half of all diabetics worldwide develop some degree of neuropathy. Nearly half. That's an enormous number. And the worst part? So many people don't even know they have diabetes. They only discover it once their nerves are already severely damaged. When the numbness gets so bad that they start losing all sensation. They no longer feel heat. They no longer feel cold. They don't even feel pain. And that's when the real nightmare begins. Small wounds start appearing on their feet, sometimes from a tiny scratch, a minor cut, a blister, or an ingrown toenail. And those wounds never heal, because the nerve that should be warning them that something's wrong has simply stopped working. And do you know what comes next? Ulcers, infections, necrosis, and amputations. And no, I am not exaggerating. Every single day, yes, every day, I see patients come into my office or the hospital, and when we examine them, there's already an open, deep, infected wound. And when we check their tests, their blood sugar is sky high, completely out of control for years. And then comes the sentence I've heard countless times. Doctor, I've been feeling this tingling, this numbness, this little shock, but I thought it was just a nerve. I thought it was stress. I thought it was poor circulation. I never imagined it was diabetes quietly destroying my body. And now, let me ask you something serious. If I told you that this could be prevented, would you believe me? Well, believe it, because it absolutely can. Do you know how? Through strict blood sugar control. And don't fool yourself. It's not just about quitting sugar. It's not just about taking a pill every now and then. It's about daily control. It's about regular tests. It's about medical follow-ups. It's about changing your eating habits. It's about physical activity. It's about discipline. Because I promise you, treating diabetes is not just about controlling glucose. It's about protecting your nerves, protecting your eyes, protecting your kidneys, protecting your heart. It's about protecting your life. And now, looking directly at you, I have to ask, when was the last time you checked your blood sugar? Do you know what your hemoglobin A1C is? Do you know if you are already at risk? Because if you're feeling tingling in your hands, numbness in your feet, those strange electric shocks, that burning sensation that feels like fire crawling up your skin, don't ignore it. This could be the sign that your glucose is silently, slowly destroying you from the inside. And here's something you probably didn't know. There are famous people who went through exactly this. One example is the legendary singer Elvis Presley, who, shortly before his death, was already suffering from severe diabetes complications, including... Does this sound like an exaggeration to you? Well, it's not. This is the harsh, raw reality that illness imposes when you don't take it seriously. And do you know what's even more shocking? Most people only realize the damage when they're already at their breaking point. But you don't need to, and you absolutely shouldn't let it get to that point. If today you're feeling these warning signs, if numbness has already become part of your daily routine, if that tingling sensation comes and goes, then returns again, this is not normal. This is your body screaming at you. And you need to listen, you need to act, you need to take care of yourself before the situation spirals completely out of control. That's why I'm giving you an invitation. No, this is more like a life mission. Starting today, look at your health with the seriousness it truly deserves. Check your blood sugar, do your medical checkups, control your diet, move your body, follow your treatments, and do not neglect it. Because if there's one thing I've learned over all these years in the clinic, it's this. The person who manages diabetes from the beginning, who doesn't wait for the bomb to explode, lives better, lives longer, and above all, lives with real quality of life. If you're someone who spends long hours on the computer, spends too much time on the phone, or does repetitive tasks at work like typing, driving, sewing, or even cooking, then pay close attention to what I'm about to tell you. Because that tingling in your fingers, that numbness that wakes you up in the middle of the night, that heavy arm that feels anesthetized, that is not normal. It's a clear sign that you may be developing something called carpal tunnel syndrome. And believe me, it's much more serious than you think. Maybe you've never heard this name before, but I guarantee you've felt the symptoms or know someone who has. It usually starts like this: a nagging numbness, usually in the first 3 fingers of the hand, the thumb, index, and middle finger. Sometimes it even affects half of the ring finger. And do you know what's really strange? It almost always gets worse at night. You wake up in the middle of the night with that heavy, tingling hand, like it doesn't even belong to you. And then comes the classic scene, shaking your hand to relieve it, opening and closing your fingers, squeezing, massaging, doing anything possible to make the discomfort go away. But why does this happen? The explanation is simple and at the same time terrifying. In your wrist, there's a narrow passageway called the carpal tunnel. Inside it runs a very important nerve called the median nerve, along with tendons that control your finger movements. When that space gets tight, whether due to swelling, inflammation, fluid buildup, repetitive strain, poor posture, or fluid retention, that nerve starts getting compressed. And that's when the pain, numbness, electric shocks, tingling begin. And if you don't treat it, this can evolve into something much worse: loss of strength in your hand. Have you ever felt something suddenly slip out of your hand without meaning to? Tried to open a jar and realized your hand just wouldn't cooperate? Or even struggled to hold a pen, a spoon, or a glass? Yep, those are clear signs that your nerve is suffering a lot. And let me tell you, this doesn't discriminate based on profession or age. It affects people who work in offices, artisans, drivers, and even those who take care of the home. Now I'm going to share something very personal with you. I have carpal tunnel syndrome myself, and I know exactly how uncomfortable it is, how limiting it becomes, and that if you don't take care of it, it can even prevent you from doing the most basic daily tasks. Want a real-life example of how serious this can get? The singer Paula Fernandez publicly revealed that, at the peak of her career, she had to stop everything and step away from the stage for a while because of carpal tunnel syndrome. And believe me, for someone whose life depends on their voice and hands to perform, this is absolutely devastating. She had to go through intense physiotherapy sessions, constant medical follow-ups, and completely change her daily routine just to avoid surgery. Now imagine what this means for someone who isn't famous, who doesn't have an entire medical team at their service. So let me ask you this. How many hours a day do you spend on your phone, on your computer, driving, sewing, cooking, or doing repetitive movements without even realizing it? And when you feel that numbness, that tingling, do you just assume it's normal, that it's part of life, part of being tired? Because let me be absolutely clear, this is not normal. This is your body sending you a warning sign. And here's something else. Do you know why this tends to get so much worse at night? When we're awake and moving, our muscles help pump blood and drain excess fluid from the tissues. But when you lie down, stay still, and your body relaxes, the fluids redistribute. The tissues begin to swell, and the space inside the carpal tunnel gets even tighter. The result? Numbness, tingling, and that uncomfortable sensation that wakes you up in the middle of the night. And if you think this will just go away on its own, let me be very clear, it won't. In fact, if you don't treat it, it will only get worse. And treatment isn't just about taking medicine or rubbing some ointment. It involves physical therapy, wearing a wrist brace at night, one of those splints that keeps your wrist straight while you sleep, changing daily habits, doing specific stretches, and in more advanced cases, yes, even surgery. Because when a nerve suffers prolonged compression, it begins to lose its ability to conduct electrical signals. And do you know what that means? It means that in addition to pain, you start losing function. And once function is lost, it often doesn't come back. Now, I want you to seriously think about this. How many times have you woken up with a numb hand, shaken it, massaged it, and told yourself, "Oh, it's just poor circulation, it'll pass"? How many times in the past few weeks, in the past few months? And how many times have you ignored it, pushed it aside, telling yourself you'd deal with it when you had time? Let me tell you with total honesty, time doesn't wait. Nerves don't wait. And when a nerve stops working, there's no going back. So don't wait for it to get worse. Pay attention to your body. Notice the signals. If this is happening to you often, seek help. Get a diagnosis. Take care of it. Because if you act early, you can solve it. But if you leave it for later, later might be too late. And I say this with the full responsibility of someone who sees this happening every single day. In the clinic, in the ER, in real life. Numbness is not normal. Tingling is not normal. Your body is crying out for help. Listen to it. Take care of it. Take care of yourself. You're probably going to be surprised by what I'm about to tell you, but you need to know this. There's a disease that many people think belongs to the past, something from old movies or history books. But sadly, it's still far more present than you might believe. And worse, it could very well be the real cause behind that constant tingling in your hands, that unexplained numbness, that strange loss of sensation that seems to have no explanation. I'm talking about Hansen's disease, historically known as leprosy. And maybe right now you're thinking, "Doctor, that doesn't exist anymore, right?" Well, here's the shocking truth. Brazil is the second country in the world with the highest number of Hansen's disease cases, only behind India. And the worst part? This disease is completely treatable and curable. Yet thousands of people continue to suffer from it every year, people who often live with the symptoms for years without even knowing they are sick. Do you know why this happens? Because Hansen's disease is sneaky. It starts with very subtle signs. A small light patch on the skin, whitish, sometimes a bit brownish or reddish, that seems completely harmless. It doesn't itch, it doesn't hurt, it doesn't bother you. But there's one key detail that changes everything. The patch loses sensitivity. You touch it and feel nothing. You do a simple test. Poke it with a pin or the tip of a toothpick, and nothing. Absolutely no sensation. And that, my friend, is the very first sign that the nerve in that area is already being attacked. And it doesn't stop there. Over time, in addition to the patches, the tingling starts in the hands, in the feet, that constant numbness, that feeling that your hands are heavy, weak, like they're no longer yours. And when it gets to this point, it means the peripheral nerves are already seriously damaged. And if you don't treat it, do you know what happens? Functional loss begins. The fingers start to deform. The hands and feet shrink and atrophy. And the person is left not only with physical scars, but emotional wounds. Because even today, there is still a lot of prejudice around this disease, born from ignorance by those who don't understand that Hansen's disease has a cure. So now I ask you a very serious question. Have you ever looked carefully at your skin? Have you noticed any patch that feels numb when you touch it? Because that's the key. Leprosy is not a disease caused by being dirty. It's not because of poverty. It's not a punishment. It's not karma. This is a bacterial disease caused by Mycobacterium lepra, a microorganism that directly attacks the nerves and the skin. And the most alarming fact is that absolutely anyone, yes, anyone, can be affected by it. If you think this only happens in extremely poor or remote areas, you are completely mistaken. I have personally treated a patient who had private health insurance, belonged to the middle class, was highly educated, and spent more than 20 years wandering from orthopedists to neurologists to dermatologists without anyone being able to figure out where that constant tingling in the hands, that numbness in the feet, or that unexplained weakness was coming from. Do you know when they finally figured it out? When the disease was already in an advanced stage, causing deformities. And do you know what that patient told me? If I had known this 20 years ago, my life would have been completely different. And what hurts the most is that this could have been entirely prevented. All it would have taken was an attentive look, a simple physical exam, touching that strange spot on the skin, realizing it had no sensation, linking that to the tingling in the hands, the weakness, the numbness, and that's it. The treatment could have started immediately. That person could have gone back to a completely normal life, without pain, without suffering, without any permanent damage. Because yes, leprosy has a cure. Treatment is completely free, offered by the public health system in countries like the United Kingdom, Canada, Australia, and across much of Europe and Latin America. It involves a specific combination of antibiotics that kill the bacteria and stop the disease from progressing any further. But what must never happen, and unfortunately still happens far too often, is that people ignore the warning signs. That tingling that comes and goes, that numbness that seems silly or unimportant, thinking it's probably poor circulation, or it must be a pinched nerve, or maybe it's just bad posture. Meanwhile, the bacteria is still there, silently advancing, quietly destroying your nerves, little by little, day after day. I want you to stop right now and ask yourself honestly, do you have any spot on your skin, on your arm, your leg, that feels strangely numb when you touch it? Have you ever felt tingling, numbness, electric shock sensations, or sudden weakness in your hands or feet, and never bothered to find out what it really was? Then do not ignore it, because the difference between an early diagnosis and a late one is literally the difference between living a normal life with no lasting consequences and living a life full of pain, limitations, and scars, both physical and emotional. If you have noticed any of these symptoms, seek help immediately. Go to a health center, visit a dermatologist, see a neurologist. Explain your symptoms clearly. Demand a proper examination. because the sooner it's detected, the easier, faster, and more effective the treatment will be. And let me tell you something truly important. You have no idea how many people have completely regained their lives with zero permanent damage simply because they made one crucial decision. They did not ignore the signs. That is why I say this to you with absolute seriousness and total responsibility. Do not underestimate this. Numbness in your hands, tingling, loss of sensation, it may seem minor, but it could also be a clear warning that something much more serious is happening. And if that's the case, the difference between living a healthy life and living one filled with suffering lies, quite literally, in your decision to act right now. Because those who take care of themselves, who get treatment, who do not ignore the signs, are the ones who win. If there's one thing you should take away from this video, it's this. Tingling and numbness are not normal. These are clear warnings from your body that something is wrong. It could be your heart, your brain, your nerves, or your blood circulation sending you an alarm. Ignoring these signals could cost you dearly. And I'm not just talking about your quality of life, I'm talking about your health, your independence, and even your life itself. So pay close attention. Stop treating your body like a machine that can handle everything. Your body speaks. It sends signals. And the sooner you listen, the easier it is to take care of yourself, to prevent problems, and in many cases, even to completely reverse the issue. Now you understand that this numbness is not just fatigue. It's not just a pinched nerve. It's not just a bad night's sleep. It is, without a doubt, a warning. And now that you know this, you've taken a huge step toward a healthier, safer, and more conscious